Hello everyone, it's Dr. Anthony G. Beck, and one of the questions that I get from patients and friends, family, all kinds of people oftentimes is, what do I think about urgent care clinics, or should I, go to one of those places because I really want to avoid going to the hospital emergency room? Because if you've ever been to one of those, it's just about the same thing as going to the DMV. It's really a crazy petri dish of individuals and a lot of sickness going on in there. But anyhow, one of the things I want to do is give you some insight into what I think about urgent care places and things like that. Now, I'm not saying anything bad about the one here behind me, but at the end of the day, oftentimes life presents itself. Being a parent, I understand this all too well, and that is that we will have time to actually go and seek medical care or attention, oftentimes for something acute, a laceration or a broken limb or something of that nature, and we might need to get some medical care in the moment. Well, your options are pretty limited. You either have like an urgent care center or a walk-in clinic like we're at here, or of course the emergency room. But either way, I want to kind of give you some guidelines to empower you as a patient to make sure you don't get duped. Now, in the age of healthcare that we have, at least here in the United States, a lot of things are askew because of the Affordable Care Act, better known as Obamacare, and that kind of fun stuff. Well, as a physician, I have found that it's not a good law at all. It actually benefits physicians like me that actually do a fee-for-service and that don't actually bill insurance. But the thing about it is not everybody has the ability to be in that particular type of genre or category when it comes to healthcare. But long story short, it really comes down to this: no matter where you get your care, I really want to drive home that it's super important for you to always know up front and before you receive that care what it's going to cost you. So whether you go into a hospital or you go into an urgent care center or a walk-in clinic, before you sign anything, agree to any type of care, ask very candidly and upfront, nicely and respectfully, of course, what is this going to cost me? What am I looking at when it comes to fees? Because the reason is because I'm having patients let me know that they've had this type of occurrence where they go into a walk-in clinic for a particular acute case, whether it be a respiratory infection or a laceration or something like that, and next thing you know, they give them their insurance information, which a lot of these places will actually bill, but then they end up getting a bill back from their insurance company saying, hey, we're not paying that. And oftentimes it's because the enormous bill that actually came along with it, up to and including $10,000. I've actually had a patient get billed and their insurance was like, we're not paying that. So you need to be an informed consumer no matter what your choice or situation is. Now, it's no surprise or nothing new to know that Dr. Anthony G. Beck is highly critical of the United States chronic care model. We fail absolutely miserably when it comes to chronic diseases like diabetes and rheumatoid arthritis and things of that nature. But we excel. We are the best on the planet when it comes to acute care. So acute care is going to be, like I said, if you need stitches or you broke a bone or you have a heart attack or a stroke or something going on like that, or an infection that just came on suddenly. So we're the best when it comes to that. So one of the things that we'll actually do is find out that people are going to only make two choices. They're either going to go to their primary care physician, and if they can get an appointment, oftentimes that's not always the case. The other thing is they're going to go to the emergency room, or they might go to a clinic that is just a walk-in. So regardless if you go into any of those things, what I'd like you to do is always keep in mind that you want to know what it's going to cost you up front. You have the right to know. They are compelled to let you know, and I don't want you to get into the loop to where they're like, well, we call it the three-card Monty, where, oh, come on in, we'll take care of you, it's no big deal, and this, that, and that's not going to be that much. Get it in writing. Now, one of the things that's actually coming forward out there is even Target, I hear, is actually doing a joint venture with Kaiser Permanente, a big California medical firm. So that's going to be interesting how those clinics come around. I even know some of the like Walgreens and CVS actually have some walk-in clinics. The cool thing about them, not that I'm giving them a shout out or my blessing, but is that their prices for their care is very much like a fast food place. In other words, it's clearly indicated on boards, papers, and placards there, so you have a good idea of what you're getting into. So again, always know what you're going to be charged when it comes to going to one of these walk-in clinics. Same thing when it comes to an emergency room. Do not make the terrible mistake of thinking that your insurance is going to cover it if you hand over that little card and your deductible has been met. It doesn't work like that. Always be the informed consumer. ask questions, demand a higher level of health care from those who provide it to you, and always remember this: you're the boss, not the lab coat and stethoscope. So I hope this makes sense to you guys, and if you have any questions, reach out to me, and I'll do my best to get a little bit more specific if I didn't cover that here in this little clip. But I just wanted to make sure that I gave you an opportunity to understand that you are always in control of your health care. At the end of the day, you're the one who's responsible for the bill, so you should definitely know what you're getting involved in, and just always ask questions. Remember that you're the boss and people work for you. Until next time, let's live life in balance.